Hey everyone, it's the University of North Georgia Student Counseling Center again, and we want to talk about something really important: recognizing depression. Depression is a common mental health disorder that many people struggle with. It can affect your thoughts, feelings, and how you act. You might feel down, lose interest in things you used to enjoy, or have trouble concentrating. And it's not just feeling sad, it's a real, serious condition. Depending on the severity, it can significantly impact your quality of life and ability to function. In the next section, we'll dive deeper into the signs and symptoms of depression. Stay with us. Let's talk about major depressive disorder, or MDD. This is what most people think of when they hear the word depression. Imagine feeling stuck in a dark hole, unable to climb out. Intense sadness or loss of interest for most of the day, nearly every day, for at least 2 weeks. It's a persistent feeling that can weigh you down. MDD impacts energy, sleep, appetite, and thinking. Next, we will look at a disorder called Disruptive Mood Dysregulation Disorder, or DMDD. Often diagnosed in childhood or adolescence, it's characterized by severe, frequent outbursts of temper. These outbursts can be verbal or behavioral. Kids and teens with DMDD struggle with intense emotions. With the right support, they can learn to regulate their emotions. Okay, so we've talked about MDD, which is like being stuck in a deep, dark hole. Now imagine a shallower but wider hole. That's kind of what persistent depressive disorder, or PDD, can feel like. It's characterized by a chronic, low-grade depression that lasts for at least 2 years in adults, or 1 year in children and adolescents. People with PDD might experience a depressed mood most of the day, for more days than not, along with other symptoms like low energy, changes in appetite or sleep, low self-esteem, difficulty concentrating, and feelings of hopelessness. Next, we will look at a type of depression that's directly linked to the menstrual cycle: premenstrual dysphoric disorder, or PMDD. PMDD takes PMS symptoms to a whole other level, with severe mood swings, irritability, anger, anxiety, depression, and even feelings of hopelessness that can significantly interfere with daily life. The symptoms of PMDD usually start about a week or 2 before a woman's period, and typically improve within a few days after her period starts. Lifestyle changes, like regular exercise, stress management techniques, and eating a balanced diet, can help. And in some cases, medication might also be recommended. Now let's shift gears and talk about substance/medication-induced depressive disorder. This one's a bit different because it's directly linked to the use of certain substances or medications. Drugs and alcohol can have a powerful effect on our mood, but in some cases, they can actually trigger a depressive episode. The good news is that this type of depression often resolves once the substance or medication is stopped or the dosage is adjusted. However, it's important to seek professional help if you suspect you might be experiencing this type of depression, as withdrawal symptoms can be challenging and even dangerous in some cases. Alright, let's talk about another type of depression that's triggered by an underlying medical condition: depressive disorder due to a medical condition. Certain medical conditions like chronic illnesses, hormonal disorders, or neurological conditions can actually manifest as depression. This type of depression can be particularly challenging because it's often intertwined with the stress and uncertainty of dealing with a medical condition. The good news is that treating the underlying medical condition can often alleviate the symptoms of depression. However, it's important to address the depression directly as well, through therapy, medication, or a combination of both. And finally, let's talk about other specified depressive disorder. This is kind of a catch-all category for depressive disorders that don't quite fit into any of the other categories we've discussed. Just because someone's depression doesn't fit a specific diagnosis doesn't mean they're not struggling. If you're experiencing significant distress or impairment in your life due to depression, it's crucial to seek professional help. We've covered a lot today, and it can be a lot to process. Know that you're not alone. Coping with symptoms of depression is challenging, but there are resources that may help. Practicing mindfulness can help you be more present, gain acceptance, and regulate your emotions. Exercise can release endorphins and improve well-being. Participating in social activities can help reduce a sense of loneliness. Engaging in activities you once enjoyed can help boost your mood and input a sense of purpose. If you are having trouble coping, it may be time to see professional help. Reach out to UNG Student Counseling or another professional. We're here to help you find your way back to a brighter, healthier you.